am Courtney Kowalchuk. I am an adolescent child therapist. I work with adults as well. I have been doing this partnership, kind of doing a lot of these parent classes since probably 2015, 2016. I'm super excited to be here tonight talking to you guys about anxiety. The talk that we'll do in 2 weeks on the 24th, I will be presenting or facilitating a discussion on depression in the same population. So if anyone's interested in that, please come to that lesson. Again, that's going to be in 2 weeks on the 24th. All right, so I've got the presentation. I'll have it up on the screen, and I will also, Ani puts it through in the chat. You can download it there and view it on your device. The presentation is also being recorded, so like she said, you'll be able to view that at a later date if you want to go back and re-listen to things or share with someone else. So just to kind of start off, I just let people know I am totally try to hit questions as we go. And usually I'll try to stop around 6:45 and answer questions if there are any at that point as well. And so if you don't want to turn your microphone on and ask your question over the video or through the microphone feature, you can always put your question or your situation in the chat. And I look at that throughout the presentation. We'll also send you guys an evaluation or just kind of like a class review at the end where you can kind of give feedback and share with us what was helpful and if anything wasn't helpful. And we do value your feedback. So we'll send that through at the end as well. Okay. All right, let's go. So I am going to start tonight's presentation with a quote. I typically do this just to get people different perspectives and different parent feedback and kind of a discussion going. Also, just to make this less lecture-y and like we're all having a conversation. So my quote for today is, anxiety doesn't always look like a nervous child. Sometimes it looks like a quiet, angry, or difficult child. And so that spoke to me, obviously. I'm a therapist. I recognize that anxiety and depression certainly shows up, presents differently in children and adolescents than it does in adults. And this is not an area that a lot of practitioners or providers are either comfortable with or specialize in. So I recognize that there's also a need for more providers and more knowledge and more research on this. So yeah, let's go ahead and get a discussion started about this quote. What do you guys think about this? Does this ring true to you? Can you relate to this? And anybody can feel free to jump in and give us feedback about this quote. All right. It's a little bit quiet, so I'll just go ahead and kind of share some of my thoughts on this, and anyone can feel free to chime in or share your experience at any point. I think that there's some traditional markers that we think of when either we as parents or as administrators or teachers like think about anxiety. And I think that sometimes those are spot on and sometimes they're not. One of the things that I've noticed the most working with kids is that anxiety shows up very differently, uniquely with each kid. And it also shows up with physical symptoms too. So I think there's some kids that come in and, maybe they're going to the doctor's office a lot and they're complaining of stomach aches and headaches, this more like physical type response. And so sometimes parents are really confused or the doctors are kind of like, oh, well, there's nothing going on there. So, I mean, that's one way in my mind that's really glaring that doesn't really look like anxiety, right? Stomach aches, headaches, GI issues. That just looks like, oh, my kid's not doing well, maybe there's a stomach issue, right? So that's a misleading symptom, I guess I would say. And so a lot of people are saying quiet child is the most difficult to figure out. A lot of kids, this is multiple parents are noting that their kids get quiet when they get anxious. So your kids might go internal, and so they're not really presenting with any symptoms at all, maybe just with the exception of getting really quiet, kind of seeing themselves out of any sort of conflict or confrontation or interactions. And that's exactly what the quote is indicating, right? Kids get quiet. Sometimes kids they go internal. Sometimes kids they externalize that feeling, right? And they get angry or explosive, or they have this, like, as we've been talking and kind of naming this in the past classes, this like kind of unuseful or not useful social behavior, right? All these things that maybe are disruptive in classrooms or disruptive in the house, in the home, volatility, anger, irritability. And that's that kind of gearing more towards difficult, right? The challenging behaviors. And so, yeah, I think one thing that really resonates with me with this is that we can't always look at the behavior and get a clear picture of what's going on. And sometimes we have to kind of dig deeper and like, what is their behavior communicating to us? And kids are at the age where most of them are not great with emotional identification and with, emotional awareness and insight. And so that's something that we obviously really want to encourage families to teach their children, this concept of emotional identification. I'm feeling this. This is what made me feel this way. This is how it feels in my body, right? That kind of language and those types of skills. So yeah, I think that's, if anybody has any other feedback, like I said, some parents, they were really identifying with the quiet symptom or the quiet language. Okay. So one parent says, for a long time, I didn't connect anger and acting difficult to anxiety, labeled it as a bad attitude or an attitude problem. And now we get it. Now it's becoming more understood. That's great. Yeah. And there's a lot of things that we didn't understand or maybe just understood a little bit less back then. And it was certainly termed things that were shameful or kind of brought on more internalizing, kind of self-directed, oh, this is something wrong with you, you need to get it together, right? There's kind of that idea that in my mind brings more shame about on the individual that is experiencing it. And so Sarah, she says, I see quiet first and then angry and then weepy. Okay. So it's almost like a cycle for your child. It's almost like working through that emotion becomes this, unique presentation. My daughter has difficulty learning certain things. I feel like that's where she gets her anxiety. Okay. So you even see some causes, specifically academically, which I would argue is one of the biggest probably stressors for kids right now, right? Is their academic performance. And then of course their social, depending on their age, their social interactions and their social standing, that and their academic performance becomes extremely influential and impactful. How can we figure out if anger is because of anxiety? Well, Naseem, we're going to dig into that and I'll give you some more kind of indicators and maybe questions to ask to figure out in your particular situation with your child, whether it's anxiety or whether it's something else. I would start that I would start that kind of path with exploring, maybe like kind of tagging on like what types of situations is your child getting angry in, and see if you can kind of go down that path, right? First, and just kind of like logging things or like brainstorming things. And obviously, this is going to be a conversation about anxiety. I am an expert, and yet what we want you to do is know that this doesn't substitute for psychological evaluation or psychiatric evaluation. I complete those right in my own office, and yet this is going to be just kind of like knowledge and to kind of like, maybe I should, look more into this or see the pediatrician or get some specialist help. This is more just like for information. So I just want to put that disclaimer out there as well. None of this should be used in place of an evaluation if it's needed. Okay. So I think this was probably a month ago. I did the lesson on sleep, and this parent is saying she thinks constantly. She's got anxiety about lots of different aspects of life. She has a hard time falling and staying asleep because she says her mind is racing. So that's a super common symptom, right? Is these type like racing thoughts. I almost call it, restlessness, feeling like you can't slow down, things like that. So that sounds pretty typical of the anxiety picture when we look at that. I think there's certainly some techniques that we can use in terms of sleep, right? And it's going to differ from child to child, but to start, obviously we want to do all the sleep hygiene stuff and get that all situated. Some of that could be behavioral, right? Like almost like habitual, in terms of like, oh, okay, I go in this spot and I lay down and then that's where I worry, right? There's this really cool technique called prescribing the symptom. And that is you actually set aside time in your day for your child to worry. So I'm kind of giving you guys a tactic straight up front because we had a parent, Adriana, reach out about her child's situation. And so, yeah, you can do this with your child when it comes to anxiety. You prescribe the symptom, which means at any point during your day, you schedule in, okay, for 15 minutes, we're gonna just talk and worry. We're gonna talk about our worries. Maybe we're gonna like cuddle and like, we're gonna use some of our coping skills at that time, but we're gonna worry. This is our worry time, right? And then throughout the rest of the day, we have this like no worry time. You only get to worry during our worry time, right? And so if she's doing this at bedtime, kind of training her to like, okay, do we need to even like put a post-it note next to bed and we write all the things down, and then tomorrow during worry time, we worry about these things, right? So depending on her age, I would try something like that. It's also really beneficial to use journaling and stuff like that before bed, or just at some point to write down to-dos or whatever it is that's worrying her. So I would kind of say start there. And those are at least a couple tactics for that specific situation. And I hope that helps. So we're going to go ahead and move on. Thank you guys so much for the feedback on the quote. It keeps things interesting when we can talk about things together and kind of have a conversation instead of me just lecturing for 2 hours, but I certainly think it's more interesting. Oh, great. So Juan shared his daughter had very high anxiety and difficulty sleeping. He says they signed her up for soccer and track and field, and most of her anxiety disappeared. She needed an outlet for all that energy. And I think that that is a great piece of advice. If it worked, you guys could certainly try that. Some people might feel like, oh, well, that won't work for us, or we've tried that. I think it is 100% helpful that we incorporate movement, right? And that's even more than movement. That's athletic exercise, right? Soccer in particular is lots of running, track and field, lots of running, right? So there is this element, we've talked about this in past classes, that we've become very sedentary and our children's lives have become very sedentary. And that's not just an anecdotal piece of information, that's being backed by the research now, which is, it's kind of wreaking a little bit of havoc on our health, right? And so there is some truth in that kids, their behavioral psychological process is centered around play, right? And play is moving and running and all of that activity, which is very energetic, right? High energy, high movement. And if we look at what they're doing on a daily basis, currently, there's not enough movement. So I think there's certainly something to be said of the power of movement and exercise. Another parent said, yes, exercise and dance has been a game changer. It's so true. I mean, I could get on my soapbox about exercise and movement, but as a therapist, it's huge for my own mental health, and for most patients that I see. If they're not exercising or not moving, and we get them to do some of that like regularly throughout the week. And this doesn't have to be strenuous exercise. It can be dance, it can be yoga, it can be walking, it can be whatever you like, right? But some kind of movement is incredibly beneficial for our mental health, both for kids and for us. So I'm glad that you guys mentioned that as well. And sharing those suggestions with other parents is why we do this in a group format, because it's so helpful. So thank you guys for that. All right. So the objectives for tonight, this is shared with you guys on the flyer. I want you guys to gain understanding of how anxiety impacts the child or adolescent brain. I want you guys to learn ways to help your child or student during stressful times, or, during this anxiety. Network with other parents dealing with similar challenges, and locate resources. We definitely want to spend a lot of tonight talking about ways to improve their coping. Like I said, this won't be a substitute for psychological evaluation or anything like that. It's just kind of giving you guys some tips and tricks to get your kids through some of this stuff. What about tactics for kids who get anxiety? Some will cry night, not sleep because he's worried that something might happen. Yeah, so I mean, that's kind of a classic picture of what anxiety is, right? It's this unrealistic thinking about the future or about what could happen. Um, I'm curious if there's some sort of trauma there that he's kind of associating something happening to you with that trauma, right? And I think that if that's like a nightly thing and he's not sleeping and, that might be something where you're going to need some extra help, maybe an evaluation or seeing the pediatrician or something might be really helpful. But we'll get into some of the skills that you can use to get to help him a little bit. Yeah, and so Cindy, I don't know if either Annie or any of the other parents, resources for low-cost sport activities. A lot of parents, I think, are finding that they're expensive. Teens get pretty bored. But yeah, I think we could kind of look around and see if any of the other parents here can chime in about that and give some resources to Cindy in the chat. I don't personally know of any of those. Okay. So kind of moving on, this is another discussion question or a chance for parents to share. You guys we're kind of already on this track right now, talking about different types of things that have caused stress or anxiety in your kids' lives. And so we can kind of keep talking about this for a couple minutes. Just, what are the things that are causing stress in your child's life? And what's their response when they get stressed or anxious? Oh, great. There's some people already responding for Cindy in the chat. Thanks, Annie. Yeah, we've already got some resources for parents who might feel like they want some or need some help with that. Yeah, and that might be a good thing to put on my list of things to look for. Okay. Anybody else want to share stuff? What are the things that are making your child anxious or stressed? Okay, Michelle says homework and time management. Certainly. I saw somebody else say, my daughter puts a lot of focus on chatty girls and friendships. Yeah, that is not abnormal. Um, Specifically when we start looking at like middle school age children, but I think perhaps with the maturity and the puberty happening earlier, we might have to lean that a little bit earlier. But typically, from the developmental standpoint, kids, once they hit the middle school age, they're going to be super focused on those social interactions with other kids. And you might find it's that kind of typical, like, my parents don't know anything. You don't understand me. You don't know anything. It's just my friends that get it. Right. And that's very, very developmentally appropriate. It happens to all children. So, like, you're not doing anything wrong. That's normal. And like I said, we can kind of talk about some things to combat this like worry or anxiety that they may have. Personal performance anxiety, so like kind of some like perfection or people pleasing, like things like that sound like maybe some of the things that are happening for some of you guys's children. Okay, so some people are saying like some bullying is happening, which is not okay. Oh, tutoring. Yeah. So kind of like some of these practical solutions. Yeah. Worrying about failing a class. Bindu, absolutely. So academic stress and worry becomes one of the biggest worries for maybe when kids get a little bit older, right? Depending on their maturity levels and things like that. Oh, and Juan said climate change is making their child anxious, getting answers wrong, too smart, too thoughtful, pressures of middle school, trying to find their way and keep up, health worries. Okay. Yeah, so there's going to be some of these that are like situation specific, right? What if situations, some are daily life, elementary kids learning new material, afraid to ask for help. Yeah, there's this kind of like, right, with the academic performance and then also social standing, so to speak. They don't want to look, they don't want to get made fun of in front of the rest of the kids or seem, oh, they're going to think I'm stupid, or right. There's a lot of worry that comes in, um, particularly for like elementary age kids when they still don't understand like, hey, everybody needs help, right? Afraid to ask a help. Yeah, validation from teachers. Totally. Yeah, so you guys are, thank you so much for your feedback. There's a lot of this that sounds very, very typical, right, for this age range. Yeah, so there's also some age or some situation specific, like health, worrying about health issues or death, right? One parent said their daughter's anxious about death after the cat died. So this kind of like exposure to something can prompt worry, right? And I think one of the things that I try to teach parents is that some of this is relatively typical, right? Psychologically typical or developmentally normal when we talk about kids, particularly because of their brain development, their emotional regulation, the impact of stressors on their brain is simply different, right? Their emotional regulation does not kind of round out and solidify until they're much older. And so some of these like normative things in life that happen, death, loss, right? Accidents, health stuff. I think the majority of these things can be talked about in a level like, okay, there's a lot of there's there's a lot of normalcy to that. And yet what we're going to get into further is like what the anxiety, like um a clinical anxiety is going to elevate beyond that, where it's kind of chronic, it's been hanging around for a long time in multiple different domains, and we'll kind of talk about what that means. um Failure in sports and at school, sure, doubts his own abilities and skills, frustration and anger at himself. Yeah, so some people are sharing like bullying. They feel like maybe the school's not equipped to handle the bullies, and it's kind of they feel that the parents need to try their best at home. I would argue that like always reporting that stuff is super important, and I hope that you guys get some help and some support from the school and the administrators that you are with, that your kids go to school with, and then also certainly trying to deal with, how we react to people and how we respond to those sorts of situations. Is all this emotional education for our kids is certainly helpful. Um, yeah, one person shares, I tell my daughter she's going to meet a lot of friends and the opinion of a girl in her class won't matter or make a difference in her life. I don't think that's not right to say. I think that there's some like reality in that statement, right? Kind of trying to, I would say, validate that, oh, it really hurts when people say things that, that don't feel good, or, you know, I wonder, like, you know, kind of, like I said, validating the emotion. And then I wonder, like, how she would feel if somebody was mean to her, or, you know, trying to kind of take different perspectives. And yeah, certainly kind of letting them know like how you react to her is going to make a bigger difference. And what she says doesn't define you. And I think that's good advice for your little ones. Okay. Yeah, so now we're going to actually get into some of the bulk of the information on anxiety in childhood and adolescence. When we talk about anxiety, and this is kind of where we're going to dive in and talk about that like normative anxiety versus not normative, and we will get really into that as we go. And the reality is that anxiety is a normal stress response, right? We are biologically, physiologically programmed to have this response. It's shared by all humans. And the reality is that it's a protective factor, right? We look at the biological process of the activation of the sympathetic nervous system, which is what activates when we are in stress, in times of stress, right? That's the fight or flight system that essentially gets us away from danger. And so it is very valuable when we look at anxiety as it relates to human mental health. It's telling us something, right? There's a danger. I need to either fight it or run away. And so that is really helpful also to just teach your children, right? Like there's some function, some psychological function to this feeling. Anxiety can be motivating for some of us, right? It's like, oh, I'm really worried about this presentation, and so I'm gonna like make sure my boss is gonna be there, or my boss's boss is gonna be there, and like I'm gonna make sure that I know all the material and I've got everything situated, and right, and like that's that productive anxiety of like I don't want to look like I don't know what I'm talking about, or I don't want to not have an answer to a question. And so that motivates us functionally to study or to put things together, to practice, right? To kind of know our stuff. And the reality is that when this becomes excessive, that's when it becomes problematic, right? And this can happen from a variety of, anxiety happens for a variety of reasons. And what we're really trying to look at is if something becomes clinical anxiety, it's going to hit more domains. And when we talk about domains, we mean pillars in life, right? So if you have a child who's really only anxious about school, and there's not really anxiety showing up at home or socially, or if your child also works, right? Like look at all aspects of your child's life and how many of those is this anxiety problematic in, okay? And so that might give you a little bit of an indication of like, okay, this is happening socially, this is happening at school, like academically, this is happening at home, like this is affecting, right, all of the domains, everything, everywhere that they go, everything that they do. And what we also want to look at is like, is this, like we were talking about, is this a situational, anxious event, or is this short term? Is this like, oh, the cat died and now he's worried about, he or she is worried about death? To me, that's more in the short term situational, right? This is like kind of a normative situational response. And I'm just taking that at face value. We didn't get into the specifics about that particular situation. So I'm just using that as an example. But look at the longevity of this. Is this new? Is it completely sudden and like inexplicable, meaning you can't make meaning? This didn't come from a specific situation. There is no, prompt catalyst or clear catalyst to this anxious behavior. You can kind of ask some of these questions like, has there been recent trauma? Has there been a family member died, or a parent or a relative got deported, or someone, a family member was attacked, or they saw, were witnesses to a natural disaster, or, right, there's like some of these things that are incredibly maybe clear in our mind that this would be a traumatic situation. And so asking yourself those questions, this can be linked to that new anxious behavior or this new worry. We also talk about, is there chronic stress in the family's life? Is there a divorce with difficult co-parenting, or some of those elements that I know Heather she talked about last class? We would consider something like that chronic stress, right? Or toxic co-parenting, or something like extreme poverty and lack of resources, or, right, there's kind of a multitude of things that could be chronically stressful. We also know that there's a hereditary or a genetic component to mental health, and specifically when we're talking about depression and anxiety. Is there a parent with anxiety or depression, whether it's untreated or treated? And when we're working specifically with children, we also see that when parents are struggling, their kids are typically struggling. Or if we see a struggling kid, typically their parents are struggling, right? And so we find that a lot of times when we're stressed or we're anxious or we're depressed, our kids either model that behavior, or it kind of rubs off on them. So there's some of that as well. Genetic link, and then maybe even just, environmental factors and things like that. We also talk about children and adolescents is kind of prime likelihood for mental health problems to arise. And so what that means is, if a person is going to have anxiety or depression, typically it shows up in childhood or adolescence, typically because of the way the brain is functioning at this age and the way that the brain structure is changing. We talk about there's a large brain impact of anxiety on the adolescent brain. We've talked a little bit in recent classes about the hormones of puberty. And so with those changes in physiology and the changes of hormonal fluctuations in puberty, this plus the pressure in external environment demands, right, going up in terms of academics and family life and social life. These things reshape the central nervous system. And what that means is, with those underdeveloped or not completely developed brain structures, we have a sensitivity to anxiety and depression in terms of children and adolescents. And so it makes a lot of sense scientifically that these things would show up in this age range. So we kind of already touched briefly on this, but I'll kind of go into the science of anxiety, right? And some of you can kind of check out right here if you'd like to. And if you want, you can kind of go down this little bit of a scientific rabbit hole with me. It's really just to kind of help you understand physiologically and biologically what's happening. And sometimes even sharing this with your child can be really helpful, depending on, the age and the development of your child. So here's kind of what happens when that anxious response is triggered. And remember, we talked about this just a couple minutes ago, where I explained this is a natural and planned event in human biology. And so what happens is, the decision-making area of the brain determines that there's a threat, right? And if we look at this in a normative way, this would be something like we see a bear, right? I lived in Alaska for several years, and there are grizzlies and there are huge moose. And anytime we went outside our door, we would be making sure that there wasn't a moose in the driveway or right on the front porch, or wasn't a bear hanging around. Because, right, the brain is going to determine there's a threat, right? This triggers the response in the amygdala, and then that tells your hypothalamus to initiate the fight or flight response, which is the central nervous response that we talked about, that sympathetic nervous system response. Your heart rate is going to go through the roof, right? I can remember I was going to work one morning and I opened the door and there was a huge bull moose right at the doorstep, and my heart rate is going up. Blood flow is reduced, right? You're going to tense all your muscles. In an extreme situation, emptying of bowels can happen, right? Which is, I put in parentheses, this is where the GI upset and the somatic complaints from kids happen. Kids they're not really understanding what's going on, or they're not like cognitively connecting things. But this is why kids explain or complain of stomach issues, stomach aches, my tummy hurts, maybe they have diarrhea or those kinds of things, is because their central nervous, the sympathetic nervous system is being activated when they're anxious. Okay. So that's kind of why I put that there. There's a biological reason for that. We would, in any situation, like when we see a bear, we're, out in the woods, that's what would happen to us most likely. Our bowels would empty. Breathing rate is increased. And so this is all the body's response to either fight off the bear or run from the bear. And so this is also why people with anxiety complain of lots of heart rate issues. Some people feel constriction in the chest or pressure in the chest, right? You might have a child that complains of that. Some people, even, like, I've had adults come in and they think that they're having a heart attack, or they're having cardiovascular issues. And a lot of this, after it's been checked out and ruled out by a medical doctor, we find out this is all symptomatology of anxiety, right? And so this gives us an idea of like what's happening within the body. This could explain some of your child's, I call it somatic, physical complaints, kind of helping them link that. Oh, when I feel this, I feel it here. Or when I feel angry, I feel it in my chest, or I feel hot here, or, I get sweaty, or whatever that looks like, kind of exploring that with your child. And one of the reasons that we talk about anxiety so much, or at least I do this talk with families, is because anxiety disorders are the most common mental health diagnoses in the United States. And particularly they're on the rise with children and adolescents. And I am involved in some really interesting, I guess I subscribe to a lot of really interesting research that's happening, particularly when it comes to social media and technology and the effect of these things on children and adolescent mental health. And so we're going to have a chat on that the last class, which is May 29th, and I'll get really into how I have postulated that the rise of social media and technology has actually caused the mental health epidemic with children and adolescents. So if you want to hear more about that, please come attend the class on the 29th of May, and we will get all into that. So anxiety disorders also come in a variety of diagnoses, right? We have panic disorders, we have post-traumatic stress disorder, which include things like acute stress disorder. There's different phobias. There's generalized social anxiety, generalized anxiety disorder, which is GAD shortened. That's probably one of the most common. That's when an individual is anxious about most things in life, not particularly one thing. Like maybe we have some more specific phobias and things like that. And so, like I said, this range of anxiety diagnoses is the most commonly diagnosed mental health issue. And so we find that helping parents identify possibly red flags or risk factors, we can then get early treatment or do preventative measures, because that is considered the most effective way to treat or eliminate these types of disorders if we get them early and we help kids deal with this stuff early. So we talk about a little bit, we already talked about the decision-making area of the brain, the amygdala, the hypothalamus, the limbic system, which I call the emotional center of the brain, right? It's kind of almost smack dab in the middle of your brain. This is comprised of the amygdala, hippocampus, and thalamus. This is responsible for majority of emotional processing, right? Again, emotional center of the brain, it's the limbic system. What we find is that there's actually a ton of brain differences in anxious individuals or people that are diagnosed with anxiety disorders. There's actually higher activity in certain areas of the brain. And there's kind of a slew of research on this. If you're interested, I can certainly share some of the more prominent studies with Annie, and she could send those out if anyone is interested. Otherwise, you could certainly go to like Google Scholar and just type in anxiety in adolescence and childhood, and there's going to be tons of scholarly, like peer-reviewed journals that you can read. And yet that message is just kind of highlighting what the differences are and kind of what that means for children or for individuals with anxiety. Neurotransmitters, we talk a lot about these when we talk about mental health. These are responsible for communication in the brain. So serotonin is responsible for mood, sleep, and appetite. Norepinephrine is linked to alertness and attention, and ABA slows down the signals. The disruption in these different neurotransmitters is essentially there's an imbalance, right? When we talk about people with anxiety, they find that there's an imbalance in these neurotransmitters, which leads us to kind of psychiatric or psychotropic medication treatment of anxiety, right? Because a lot of times we say, look, this isn't just a cognitive thing that's happening, right? A lot of parents might say like, oh, well, like just get over it, right? And what we want to kind of shape that is like, sometimes there's a chemical difference. Sometimes there's a neurotransmitter imbalance, and that can be caused by a variety of things. And what we want to help parents understand is that sometimes that chemical imbalance is what causes it. Sometimes medication is helpful and it can kind of get those neurotransmitters or chemicals rebalanced. And that's not something that kids have to stay on forever. I'm not advocating for medication by any means. I would always, as a therapist, I would always recommend therapy first. But it is kind of some educational information for us to understand that like, oh, okay, this is something more than just kind of an anecdotal, like you got to get over it, those types of things. All right, let's go in the chat because we might have some questions about this stuff. Oh, Inside Out, yeah. Oh, and I hopefully there's a typo. It's supposed to be GABA. It's a one of the neurotransmitter is gamma aminobutyric acid. So I said ABA and typed ABA and I meant GABA. It's essentially just it's an amino acid. And it's a primary neurotransmitter in when we talk about brain function and anxiety. Yeah, hopefully that helps. My son has lost motivation in school. Okay. Yeah, motivation can be linked with anxiety. It can also really be linked to depression, depending on the age and some of the other symptomatology. Inside Out is a great movie to watch. Yeah, so we'll get into kind of some of the ways that you guys can help your kids. We'll go over some more of the symptoms and sources of stress, and then we'll get into coping skills and stuff like that. Ways to help your child work through some of this. So we've kind of covered what anxiety is, what the purpose of anxiety is. We talked a little bit about the impact and the brain development, and specifically with children and adolescents, and then specifically the differences in individuals who have some sort of clinical diagnosed anxiety. Now we're going to get into like some of the symptoms, things that might present to you as a parent, and you might want to go, okay, like I'm kind of noticing a handful of these things. Let me maybe check in with the pediatrician if I'm seeing a lot of this, or, get an opinion, get an evaluation, something like that might be a good idea. Some of the common symptoms of anxiety are consistent or recurrent stomach aches and headaches. We talked about that a little bit, right? We kind of lumped that into the fourth thing, which is like gastrointestinal issues, nausea, vomiting, diarrhea, just kind of consistent issues with that are unexplained or ruled out. There's no medical cause for that, right? We call that like somatic responses to anxiety. Okay, some people complain of headaches. So it could be, oh, my head hurts. Oh, I don't feel good. Oh, I have a stomach ache. Like, oh, my tummy's upset and I have to go to the bathroom a lot, or things like that. Racing heart, shortness of breath. So it might also be pressure, tightness in the chest, or pain in the chest. Sleeping too little is typically what we see in terms of anxiety. I think more so with depression, we see sleeping too much. Irritable or easily agitated. And I would say being irritable or easily agitated is one of the most common symptoms in both depression and anxiety when we talk about children and adolescents, more so than like adults, right? More so, adults are not necessarily as irritable or easily agitated. We might more be like, truly anxious, on edge, right? The presentation is gonna look a little different. So if you have a child that's just like constantly irritable, and I would say irritable with everyone, right? Or easily agitated with everyone. This isn't just like, oh, he's just like that with me, or we want to look at, again, that more of like, is this more widespread? Having frequent nightmares, waking up a lot in the middle of the night, whether that means they're coming to get you, or you just notice that they're waking up a lot, moving around at night, you can hear them, having lots of nightmares. This also includes like bedwetting and things like that. If you start having issues like that, I would say that we can lump that into the same category in terms of that's going to signal that something's not right. Really low energy, consistently being unable to sit still or moving constantly, right? So you might have one or the other. A lot of parents, you might find that your kids either aren't sleeping and they have low energy, or they're consistently unable to sit still and they're just restless. So it's kind of different presentations for different children. Frequent tantrums and behavioral problems is also going to be something that we see, particularly with littler kids with anxiety. Lots of behavioral issues. Maybe they're, becoming violent at school, or they're running, or they're trying to escape, or there's a lot of those issues that show up in terms of behavioral issues. Stuff like that is going to be an indicator that there's probably something else going on. Does your child constantly discuss fears and worries? Are they talking about it a lot? Are they avoiding social events? Are they spending more time alone, like isolating? Um, we find that this happens again a lot with social media. Kids are spending more time alone, less time with their families, less time with siblings, less time with friends, more time by themselves. Worsening academic performance, skipping classes or skipping the school day altogether. That's older kids. This could be just worsening grades. This could be, again, like trying to escape from school. We have that with like younger kids, right? Lots of behavioral issues and things like that. Or getting calls from the teachers or from the principal, like things are happening regularly. These are all going to be symptoms that I think something else might be going on. Adriana's asking, is this anxiety or depression? So some of these things, they're going to have similar symptomology, but we will go over depression in the class in 2 weeks. I don't think one necessarily leads to the other. For a lot of people, they find that they have a mixed presentation with anxiety, elements of anxiety and depression. We find that in the mental health world, they are pretty co-occurring, or we would say like comorbid. They occur together a lot. So I would say some of these are going to be very similar to depression. But really, yeah, the characteristic thing about anxiety is that worry, right? Constantly being fearful or worrying about something happening, or the what ifs or things like that. Depression has a little bit of a different picture, but again, for some people, they do overlap. Great questions. All right. We're kind of midway. Does anybody have questions about things that we've covered so far? I just want to be sure that I pause and leave enough time for questions. I've been trying to answer the questions as they come up in the chat. Bindu, I'm definitely going to get to answer your question. We're going to have a lot of tips and strategies to help your kids deal with anxiety or just worries and things, with the exception of having the conversation with them, which can be really helpful. Yeah, so we're going to kind of go into like chronic stress. And we talked a little bit about this as one of the primary causes or maybe primary risk factors for individuals who develop anxiety. I would recommend that if any of you guys are interested in this, you can look up this video on YouTube called Why Zebras Don't Get Ulcers. And essentially it's this idea that episodic stress is very different biologically or physiologically than chronic stress. And so what that means is episodic stress is essentially like short bursts, right? And the example here is like running for your life from a lion, or seeing a bear and running for your life, right? Like you of course wouldn't want to run in that scenario, but just for the sake of example, short bursts of stress are much more biologically manageable and physiologically, psychologically manageable than chronic stress, right? This is sustained stress, constantly worrying about losing your job, constantly feeling stressed in a violent or toxic relationship, constantly being exposed to domestic violence or violence in the home or substance abuse or things like that, constant exposure to poverty and lack of resources, right? Like, and you could kind of take some of these examples and generalize it to your own situation, but like, is there short stress, like kind of occasional episodic stress, or is there chronic stress, right? And this is going to be kind of a key difference for us in whether something is leaning more in the clinical range than if we're talking more about just kind of like situational, short-term type response. And so, yeah, if you're interested, check that video out. It's super interesting. Robert Zapolsky, he, has this lecture where he talks about it, and it's very fascinating and very helpful and very kind of like down to earth, easily understood. So like we talked about, when there's a fight or flight response and that sympathetic nervous system is activated, there's essentially like biochemical dump in the brain and body, right? All that adrenaline, all that cortisol, the neurotransmitters firing off, like all of this stuff is happening. And then we're left with this like biological like dumping ground, right? Where excess cortisol, I'm sure as a lot of you guys know, it kind of wreaks havoc on our system, right? So when human beings are chronically stressed and we have very high cortisol levels, it impacts our system in so many ways. And so I talk a lot about exercise specifically because exercise, along with specific foods, actually destroy cortisol. And I'll say that again. Exercise and movement, and particularly there's some foods, some nutritive ways to handle this as well, actually destroys cortisol on a chemical level. And so that's fascinating, and it's super helpful, because if we can get our kids, if they're chronically stressed, right, this is something we can do to help them. We can get them moving, we can get them exercising or in some sort of sport or dance or and that's why this works, right? It's not just like, oh, it worked for your kid and it won't work for mine. Exercise actually is able to chemically destroy cortisol. And so huge win for us as humans. And I would argue for all of us, if you're stressed and you start exercising, it will do wonders for your cortisol levels. Adaptive responses versus maladaptive responses, right? This is what we look at in terms of like chronic stress. Are we making things better, or are we making things worse? And this more pertains to adults, right? And this could be for teenagers as well. Like, are kids drinking or smoking? Are they using drugs? Are they binge drinking, binge eating? Are they overscheduling themselves or depriving themselves of sleep? Right? Those are the maladaptive responses. And we do these things too, right? We emotionally eat, or we overwork, or we, don't get good sleep, or we drink, or so there's kind of a combination of those things that we would consider maladaptive responses. And essentially that's worsening that chronic stress state in the body, right? Adaptive responses like exercise, meditation, or visualization, massage, deep breathing. Some of this might feel out of reach for some of you. You might be like, whoa, we don't have the money for massage, or we don't have the money for this. It's like everybody can meditate, right? Everybody can do deep breathing exercises. You can learn how to do acupressure breathing or some of these different types of things in order to get some adaptive response in the body. And again, decrease the that biochemical dump in the brain and in the body. Prolonged stress or chronic stress causes and or exacerbates physical and mental health conditions, right? Depression, anxiety, migraine headaches, heart disease, ulcers, colitis, rash, hives, musculoskeletal and joint issues, reproductive issues, insomnia. All of these things can be exacerbated or caused by prolonged or chronic stress. And what we know is that stress is causing dysregulation, right? And it also disrupts the mind-body connection. And mind-body connection is huge, particularly for kids, because what we want to teach them is that when I think a certain way or when I feel a certain way, my body feels a certain way, right? And we want to help link that, because so many of us are so kind of like disconnected or disorganized in that way. We want to kind of help kids reform that mind-body connection, because it can be incredibly helpful with like emotional regulation and just identifying what we're feeling and being able to combat some of those like negative feelings or reduce the prevalence of some of these things like depression and anxiety.
I don't know how to respond to that.
Sorry, my watch was going off. I think she was like trying to record me. So, yeah, there's also like what we call psychosomatic disorders, right? These are things that are by definition caused by stress. So some people come in and they have tension headaches, respiratory ailments, dermatitis, like rashes, skin issues, impotence, GI issues, things like that. Those are directly related to psychological well-being and psychological issues. And so that's just kind of like furthering the evidence that like this is absolutely real and it's 100% something we should be teaching our kids. Like stress literally kills us. It shortens our life expectancy. We might want, I wouldn't recommend we word it that way, depending on your child's age and things like that, right? We want to like word it in a way that's like these, the body is kind of reacting in a way that is normal, right? When we see a bear or we see a scary animal, like that's kind of a normal response. Our body is doing this thing, that's not, it's not really in its right mind. Like we can kind of explain that in a way, depending on the age of your kid, to help them understand that your body is doing what it's designed to do. And yet their body is doing those things maybe in not actually stressful or threatening situations, right? And so like how to combat that with this mind-body connection or with meditation or with some of these different types of coping skills. Let's see. I'm going to check the chat because I do think we had a question. Oh, okay. Yeah. One parent is saying, Dr. Keisha, I hope I'm saying your name right. Keisha, says she saw all of these behaviors show up with her kid during the pandemic lockdown, which like absolutely that was like a worldwide health event, right? That was like a natural disaster. And so that caused some trauma for kids, meaning we saw a lot of trauma response, uptick in anxious behavior and anxiety disorders or diagnoses for sure. Anxiety, when you said anxiety leads to other mental illness later, oh yay. Is that if it goes untreated or if it's an indicator no matter what? So I'm not sure, Julie, what your question was referring to, what I said or where I said that anxiety leads to other mental illness. The reality is that anxiety shows up a lot of times in childhood and adolescence because of the way the brain is developing and because the immaturity of a lot of the systems. And so what this means is anxiety doesn't necessarily lead to other mental illness later. It could be that a child has anxiety and it shows up in childhood and then they get treatment and it never shows up again. That it could happen that way. If a child shows up with anxiety and it's untreated, I would say more than likely they're going to express that anxiety when they're older, right? So I'm not sure about it causing other mental illnesses. I did say that a lot of things are comorbid, meaning a lot of mental health diagnoses exist together or are kind of like commonly seen with others, right? Like anxiety and depression are commonly seen together. Trauma and anxiety or trauma and depression, right? There's some that are kind of typically linked. And so I hope I answered your question. I'm not sure. What the rest of that question means, if it's an indicator no matter what. Yeah. You're welcome. Okay. So a lot of the time I like to talk to parents about the sources of their child's stress, right? Common sources of stress for kids, tension at home from parental conflict or divorce. So you can kind of pick some of these out. Oh yeah, that's definitely happening in our life. Is it chronic or is it kind of new occurrence or singular occurrence? You can kind of like brainstorm this, right? Significant life changes like moving homes or moving states, birth of a new sibling, a new step parent or family member in the family dynamic. So like new co-parenting, right? Or now being raised by grandma or including grandma in the mix or grandpa, right? School challenges like making friends, dealing with bullies, getting along with teachers, their academic performance. I think each one of these was named. You guys shared, some of the parents shared. I think we hit every single one of those so far. So older kids, like teens, sources of stress, typically those are school related concerns like increasing pressure around grades, graduation, social pressures like fitting in, their first romantic relationships, sex, substance use. And then we have like societal concerns, right? Like climate change, gun violence, um, treatment or marginalization of immigrants or racial groups, did I say school shootings and gun violence, sexual harassment? So like as our kids get older, right, and they're specifically in this day and age where we're all so connected and there's so much influence with media and um, what's happening in the world, right? We're all much more aware of that. This is all becoming huge. These are becoming huge sources of stress for teens specifically, right? Older kids. And so, yeah, talking to your kids about these things, like even saying, like kind of helping you get an idea, oh, this is kind of where my child's stress is coming from. This can kind of help you pinpoint that stuff, talk to your kids, get an idea of maybe, oh, maybe this thing has happened and I can kind of maybe get them a little extra help or a little extra support because of these things. Okay. So finally, we're coming to the tips of how to help kids with anxiety or stress. And these are going to overlap with you as well. So if anyone has any questions so far that I haven't answered in terms of your specific situation, you can throw those in the chat. And I'll also, in about 20-30 minutes, I can stop after I get over some of this material and answer any other specific questions that you guys may have. So the reason why we talk about stress management so much when it comes to anxiety is because this is the most important thing when we talk about treating anxiety, right? When we treat anxiety, we're lowering the stress first. And there's really manageable ways of doing that and really accessible ways of doing that if we can teach people how to calm themselves and how to increase like their coping toolbox, right? Coping strategies. And so my encouragement for each of you as parents would be not only look at these for yourself, look at these for your kids, and then show your kids that you're using these. Teach them how to use them by way of modeling. Model that you are, say, learning yoga, right? Or you're exercising and use that language like, oh, I have to work out because it's really going to help me, mom, feel really healthy, or it's really going to help my brain, or it's really going to help my mood today if I go and, do a run or go walk or whatever that language is. Really getting you guys to incorporate that and model that is going to be super helpful for your kids. So I would even recommend, having the conversation. Hey, like, I'm kind of noticing that I feel like maybe you're a little worried about certain things. You can implement maybe that worry time. Maybe you implement like some journaling at the end of the day to kind of get some of those worries or stress off their mind. And like, hey, we can handle this stuff tomorrow, right? Write down everything that your brain's going to think about tonight. And then have a list of like some coping skills that you say, hey, like it seems like you're pretty anxious today. Let's go try this. Let's go do a little yoga class on YouTube in the living room, or let's go for a walk, or let's go eat a nutritious dinner and cook it together, or whatever that looks like. But like creating this and helping your child use the skills and modeling the skills is going to be one of the most beneficial things that you can do as a parent. So to get in some of the strategies in terms of coping strategies, we talk a lot about like mindful, intentional relaxation. That might look like, I know during the pandemic, Headspace was actually free for a lot of different people, like first responders and teachers and things like that. So I don't know if they extended that. You could always look it up and see if they offer a free subscription to Headspace. Alternatively, I know it's like a couple bucks a month. And if that's something that you're really struggling with, it could be worth it. I love Headspace. I think that I wish it didn't cost money, and yet I recognize why it does, because it's such a beneficial tool. They have things to help with sleep. They have meditations where they guide you through the meditation, and they essentially are teaching you how to do it. And at the same time, you can find a lot of this stuff on YouTube. If you are super interested, you can look up progressive muscle relaxation, PMR. You can look that up on YouTube, and you can find any sort of guided progressive muscle relaxation exercise, which is a superb form of meditation. And you can find it with exactly what you like and the voice that you like. Maybe it has music, maybe it doesn't, maybe it has a, male's voice, or if you like, you could find any which combination that you like on YouTube. There's so many people that do it. But intentional, mindful relaxation exercises. I would recommend that you schedule this into your day, or you schedule this into your child's day. Okay, so for 10 minutes before they go to bed, we're going to do a progressive muscle relaxation together. And if that's weird and they don't want to do it with you, like, hey, we're all going to go into our own rooms and do this thing, or like however you need to work that in, doing it every day is extremely beneficial because it's preventative, right? We're trying to lower the anxiety overall rather than addressing it when it's at its peak. Obviously, caffeine increases anxiety. I tell any of my patients, if they come to me and they have anxiety, I say, stop drinking caffeine first. It's hard, but it's definitely doable. But limiting your caffeine intake is certainly going to decrease your anxiety, even just a little bit. And certainly eating nutritious meals, getting good water intake, right? Those are all kind of basics that probably so many of you have heard before. Exercise, including yoga, like I said, movement of any kind. Encourage or require physical activity for like 30 minutes a day. This can look like walking as a family. This can look like an exercise bike if you can find one. This can look like sports. This can look like something that you pull up, a HIIT workout or a calisthenic workout on your TV or your laptop in the living room, stretching that you do as a family. There's so many options, particularly with, of course, social media. You guys can do it as a family, and you can even get that stuff for free. But what we want people to understand is that the exercise does not have to be vigorous. It doesn't have to be vigorous. It doesn't have to be exercise, right? It could be movement. I recognize that exercise for a lot of people, especially really chronically stressed people, it feels out of reach. So just promote movement. Healthy sleeping patterns is incredibly helpful in treating and addressing anxiety. And we talked about this in the course that I did about a month ago. The one before last was sleep hygiene. So you could go back and re-listen to that course if you missed it. It's going to be incredibly helpful in terms of preventative measure and also treatment if you have an anxious child. We talk a lot about less screen time before bed. So shutting your phone, TV, computer, all that stuff off 2 hours before bed. It makes a really big difference in our sleep patterns, our circadian rhythm, our natural melatonin production, all those things. Deep breathing exercises. So this goes along with that mindful, intentional relaxation. You can find all different kinds of breathing exercises. There's RAIN, RAIN. You can look that up. There's acupressure breathing. There's eye rolling breathing. There's I mean, you could look up deep breathing and there's probably 1,000 different exercises that you could do. And I would say pick any of them and find one that you like, because deep breathing, specifically when you do 10 deep breaths in a row, actually is flooding the brain with oxygen. And if you do it right now, I tell people, sit down, do 10 deep nasal inhale followed by mouth exhale. And it's almost like you get like a hit of oxygen. You kind of, I always tell people, sit down when you do it because you might get dizzy or like, oh, like it's really amazing the effect that it has. If you do it 10 times in a row, it's really beneficial for the nervous system, for resetting the sympathetic nervous system. Doing those deep breathing exercises, again, you don't have to be feeling stressed. You can just do 10 deep breaths. Maybe you're in your car and you're on your way home from work, or you get home from work, because I know your commutes might be a little bit stressful. You get home from work, you go in your bedroom, you take your work clothes off. Maybe that's all the time that you get, and you take your 10 deep breaths, right? You turn the light off, you close the door, you change your clothes, you do your 10 deep breaths, and then you go out and you do the chaos of the nighttime routine or whatever that looks like with dinner and the kids, or another job, or who knows what that looks like. But again, 10 deep breaths can do absolute wonders for your nervous system. I'm really big on recommending, as a therapist, I'm really big, particularly with kids, but with everybody, eliminating processed foods and eating more whole food diets. I wouldn't even call that a diet, like whole food lifestyle, right? Eating less processed foods is it's going to change the game. This is coming out more and more, how this is linked with certain things, right? I'm hopeful that a lot of you guys, you could probably anecdotally feel it, right? How do you feel after you eat a nutritious, well-cooked whole food meal versus eating processed food, right? Highly processed or like inflammatory foods. You feel the difference, right? I think all of us can kind of feel, oh, like I don't feel so good after I ate that McDonald's versus, eating something where I cooked, veggies and meat and rice or something like that at home. And again, we recognize too, there's a level of like, how much I can access, right? What can I access? How can I get this, incorporate this into my lifestyle? That's like a whole nother lens. Acceptance. One thing that we really, when we work with anxiety, we talk about acceptance of what is, right? Acceptance of our circumstances or the things that we cannot change. And there's this element, a technique called radical acceptance, which it is pretty radical. And for a lot of people, it's hard. And yet it's one of the best skills that we have when we work with people with really intense emotion or a lot of distressing emotion, right? And that is, this is the way things are. This is the way things have to be, right? Some of these like accepting coping statements can be really, really helpful, because then there's no resistance. There's no resistance to this idea of like what's happening or what we're experiencing. It's just kind of like surrendering, like I'm accepting what is, right? This is the way that things are right now today, or this is the circumstance that my life is in. And it doesn't necessarily mean that we accept it and we leave it, right? Or we accept it and kind of wallow in that, or there's more to it. It's like, okay, I'm going to accept that right now, today, in this moment. I'm not going to judge. And then, once I'm done feeling that, I'm not going to feed it anymore. I'm not going to ruminate it on anymore, but I'm going to like accept that and kind of allow myself to feel that. And then I'm going to move forward. Right. And maybe I'll feel it again tomorrow, or I'll feel it again next week. But like, there's a level of healthy acceptance that we can utilize with some of our emotions or some of our circumstances if they're out of our control. One of the top tips for improving stress and anxiety is learning your triggers. What triggers you to go into an anxious episode, right? And sometimes this is really helpful to talk to your kids about this. Like I said, we had a parent that was asking about this. How do we know if it's anger or like anxiety causing anger or something else? Like you kind of have to go detective a little bit, right? Like learn what triggers your child's anxiety and then kind of talk to them about it, right? Like if they're able to identify that. And sometimes it's more so just like, hey, like when you feel that like worry feeling, like where do you feel it in your body, right? And then they might say like, oh, I kind of feel it in my stomach, right? And you'll say like, well, when have you felt that before, right? When have you felt that feeling in your tummy before? Oh, well, sometimes I feel it when I have to go up in the front of class, or sometimes I feel it when I go to a party and there's people there that I don't know, right? Or like whatever that is, just kind of talking to them about we want to help them identify the things that cause the anxiety, because then we can kind of work through that specific scenario, or we can kind of say, okay, well, we can put your thoughts on trial, right? How much evidence is there that kids are going to make fun of you at school? Have they ever made fun of you before when you've went up and given a presentation? Okay, if they have, is it helpful to think about how they're going to make fun of you, or is it hurtful, right? Is it going to like help you or hurt you in that situation? So then there's like, once you learn the triggers, then you can help your kid identify ways to combat that specific thing. Talking and sharing your experiences with others, right? So your child being able to talk about what makes them anxious sometimes is really helpful. And you can just say, hey, like, do you want to talk about what you're worried about? Again, and you could even do it in that prescribed time period. Like, okay, now today from 5 to 5:30, that's our time to talk about our worries and our anxiety. Like, let's talk about it and share about it, and I'm going to be here for you. And then we're not going to talk about it outside of that, right? Like that's just one technique, but simply talking about it and sharing that experience with others can be obviously super helpful. I look at that as it's like mental hygiene. We're pruning the bushes or the leaves or the overgrown trees in our mind, right? By simply talking about it with other people. It's something that human beings do that's incredibly beneficial. Obviously, going to a physician or a therapist to talk about stress lowering strategies, or to engage in some of that deeper therapy work or medication therapy or psychiatric therapy, psychiatric service is going to be, it could be very helpful. And that's kind of what we're getting at is, if some of this stuff feels normative, you can use some of these coping skills. If it starts to feel like this is becoming chronic or excessive, you're definitely going to want to go to your physician and talk to them about what's going on and what you're experiencing with your child, and they can make the appropriate referrals and things like that. Okay, so we talked a little bit about this earlier, and I'm just going to touch on this. Stress and worry is totally developmentally appropriate at all ages, right? But there is a difference between short-term situational stress versus chronic and like affecting all domains of life, right? So there's a medical impact, there's a family, school, social impact. that's going to be where it's leaning more clinical, right? So getting that pediatrician or further specialist advice is going to be what I would recommend, but also recognize short-term, situational, that kind of stuff is really developmentally appropriate. So use your best judgment, seek help when it's appropriate. We definitely want to, I would encourage you to take preventative action, right? Be preventative rather than reactive. Oh, yeah. So we have a parent, her daughter had cancer when she was 7 and she's 12 now. So she went through, wow, 2.5 years of chemo treatments. That's so hard. And she's dealing with a lot of separation anxiety when she's at home. She does great when she's at school. Tracy, I would try that, like prescribing the symptom thing, like try allowing her to have some anxiety time, right? Where you just talk about what she's worried about. And then not outside of that. If there's a lot of excuse me, separation anxiety, I would say, because what is she afraid of, right? Is she afraid of something happening to someone when you're separated? Like, is there more to it? So I would ask questions about that. Is it like someone's gonna die or someone's gonna, right? Like, is that kind of what it's linked to? I would help her work through some of that just by talking about it. And then you can also, I find giving kids like a transitional object in a way. If you have a child who, and this is with any age, I do this with my toddler, you give them an object that kind of reminds them of you, right? Because separation anxiety is like really, really normal. And yet we want to address it. Give them an object, like kind of explain to them, like, this is something that, and you can let them pick, right? Like pick some item, whether it's like, you want it to be something that they're not going to lose, or it's not going to like become hidden. And then now we're stressing about where it is, right? It could be like a sweatshirt of mom's or dad's or a t-shirt, or it could be, we used my husband's watch that doesn't work anymore and he doesn't wear. um, Something. It could be a rock with you guys' names painted on it or written on it, a picture of you guys, right? Picking what we call a transitional object, and then saying like, hey, mom's going to be at work or mom's going to go here for this amount of time. And like, I want you to hold this object is for you to hold and look at when you start missing me or you start thinking about me, right? It's going to be with you when I go. And I always come back, right? Like mom's gonna be back or dad's. So kind of, again, you might have to generalize that to your own situation, because I'm not sure exactly like what the separation anxiety looks like for her and like and under what circumstances that's happening. But on top of therapy, I would try that. Because it sounds like it's not happening when she's at school, which is great, right? This might be like a home thing you guys can deal with. And again, she went through a really serious trauma, right? Cancer is very scary, and I don't know all the details, but there's worry of death or loss with cancer, right? And so that could be something that has triggered these like, oh, I'm worried that something bad's going to happen to someone. I would say most kids, particularly if they have a good, responsive, supportive parent, they're going to grow out of a lot of this stuff. A lot of times with like PTSD or acute stress disorder, trauma, anxiety, time does heal that, right? And especially if like I said, you're doing some preventative action, she's in therapy, like very, very common to heal this kind of stuff. So those would be some of my suggestions to kind of start with. Um, and I hope that that is helpful. And if you can relate to that in any way, maybe you've got another child with health concerns or um, they're afraid of death or things like that, or separation anxiety, you can use some of that stuff as well. Okay. So kind of wrapping up, we're going to go over the ways to support your student and some more resources. So use conversation to support your child. We're not trying to like reprimand them, educate them, lecture them, right? We're just like, hey, how can I support you? And if your child's identifying that they're anxious, just say like, do you want me to problem solve and help you, or do you want me just to listen, right? And hopefully they say, I just want you to listen. I just want you to be here. And I often try to tell parents, like, be a piece of furniture in the room, just be there to support them. Sometimes they don't need all that other stuff. And even like, oh, well, I deal with it like this. You could ask them, hey, I've kind of felt that before. Would it be helpful if I told you how I dealt with it? Instead of kind of going right into how you deal with it. Sometimes it can feel a little bit invalidating to do that. So that leads us into the second one, like, try not to minimize, dismiss, invalidate, right? Oh, you just need to get over it, or oh, you're just worrying about nothing, right? Like, that's very invalidating. Maybe we feel like it's true, maybe it is true. We just don't, that's not going to be helpful, right? So like validating your kids' emotions, like, oh, I can understand why you'd feel that way, right? I can understand that you would feel really stressed or sad or feel scared about us being separated. Like, I can understand that, right? Maybe you're not saying like, oh, this is totally legit and I'm like supportive of this or condoning this. It's just like validating their experience, right? That's understandable. Like, I can imagine I might feel that way too, right? Validation is probably one of the best skills that we can use in terms of relationships with our kids or with others. There's some key elements there of just like empathizing, putting yourself in their shoes, right? One of the things that we talk about in a therapeutic context is trying to help parents not reinforce the anxiety by allowing the avoidance, right? So a lot of times I'll see kids in schools and the parents, the teachers will say like, oh, well, this kid, they're absent all the time, and like the parent just like lets them not come to school, right? They have school anxiety, and the parents just like, oh, right, they're just not gonna come. And so obviously that's avoidance. They're avoiding the thing that they're anxious about, right? If you have somebody who's anxious to go to the grocery store, what we don't want is you to allow them to never go to the grocery store, right? Because that's just reinforcing that anxiety. What we would want to do is you can do something called exposure therapy with professional help. You can also do this thing where we kind of like do baby steps, right? Well, let's get into the parking lot. We're going to go and we're going to start first period, or we're going to go and we're going to make it to lunch, right? Like doing these things. And then oftentimes your kid gets there and they forget about that, right? They either get into the groove or that, right? So like, but what we're not doing is we're not reinforcing the anxiety. So I hope that makes sense. I wouldn't use that as a blanket statement. You're going to want to use that in conjunction, like I said, with some other techniques. And if you've got a kid who's super anxious about things and it's affecting, again, all of their domains, and there's some clinical features to that, you're going to want to use the advice of professional help. But that's definitely a recommendation that we use as therapists. Don't reinforce the anxiety. Again, modeling appropriate emotional awareness and coping. So showing your kids that you're doing the things that we're asking them to do is incredibly important. Kids don't do what we tell them to do, they do what we do. So modeling that is really, really crucial. Get them a journal. You can get cheap journals on Amazon or like from the dollar store, right? Encouraging them to use the journal, whether it's like writing their thoughts down before they go to bed or writing their to-do list so they can kind of keep those restless thoughts out of their head at night. It could be getting them a journal and allowing them like drawing what their anxiety looks like for younger kids. Like, oh, what does it look like? Like, let's draw the anxiety monster, like the worry monster, right? Like, what does he look like? And what's he worrying about? Kind of getting them to do like some art type journaling can be really helpful. We talked a little bit about like healthy outlets, getting their energy out, right? Soccer, yoga, walking, skateboarding, biking, movement. We talk a lot about like a social support network, which is incredibly crucial for all of us, right? Whether it's FaceTiming family members if they're far away, making friends with a kid at school and kind of finding some time to hang out with them. Support networks are kind of crucial for us. I think we all kind of noticed that during the pandemic as well. We talk a lot about, again, promoting exercise and a healthy diet, minimizing sugar, and caffeine and processed foods. I kind of foot stomp that with my patients. Again, parents modeling self-care and stress management strategies. That's the best way to create resilient kids. It's one of the best ways we can help manage stress, which in turn decreases that prevalence or rate, I guess we want to say, that the impact of anxiety or depression. Sharing your experiences, this provides children with permission to be overwhelmed. So like talking to them about like, oh, hey, like I felt like that before, like, would it be helpful if we talk about it? Right? It's going to give them permission. It's okay to be overwhelmed. It's normal to feel these things, right? We're going to give them a roadmap on how to regain some control over what they can control and kind of help them by brainstorming ways to gain some control over their circumstances. If they're feeling super anxious about climate change, maybe they watch less social media, they consume less media, right? Because that can certainly just be a constant in their feed or in their mind, right? Of like this constant worry. There's certain things that you could problem solve with them to help them do that. Okay, so I wanted to save some time and space for anybody who has questions. What I wanted to let everybody know is I've got the contact information for Annie and myself up on the screen. If you want, you can screenshot that. You can send any questions at her email address. My information is there. I do this as a partnership between North County Family Counseling Services and the San Marcos School District. So, yeah, if you have questions, you can contact one of us. Let's see. Yeah, you guys are so welcome. So does anyone have any questions about what we covered today or anything else that's specific to your situation? Annie, if you would share the evaluation form too, that would give people some time to complete that and send us some feedback if you'd like.
I included the survey link in the chat, so if you can all take a minute to answer that, that'll be great. Thank you.
Awesome. Daniela, so the contact info is on the screen currently. Let's see. Can I? Thanks, Angelica. All right, I'm not hearing any questions come through. One person, I don't know what is happening with my screen. I'm going to stop screen sharing for a minute and Ani, somebody was asking for the contact information. If we can share that in the chat. Somebody has a question. Yes, the presentation is recorded. Annie can share how you guys can access that. Okay, someone has a question about diagnosing clinical, like depression, OCD, phobia versus therapy. Clinical analysis or diagnosis can only be done through a psychologist, not therapist. Actually, that's not true. Therapists and psychologists can do full psychiatric diagnostic evaluations. So if you find a therapist, they can do a full clinical evaluation in terms of diagnosis. Psychologists are just one type of therapists, one type of therapist. I hope that helps answer your question. Good advice for older teenagers. I do offer that in my private practice, clinical evaluations. Let's see. Do you have any good advice for older teenagers, stress and anxiety? Older teenagers, like, are we talking like 18, 19? Since they're getting older, I would start out with like, what are they most anxious about? It's probably gonna have to do maybe with like graduation or work. It might be like social and relationship stress or anxiety. That's super broad. My advice would be, yeah, just kind of like getting them using some of those positive or adaptive coping skills, right? So like, what do they currently do to help reduce their anxiety or stress? If you can say, maybe they get on their phone, or maybe they sleep, or maybe they, some of those things can be really unhealthy or actually kind of like worsening, right? Get them to start doing some sort of movement, get them to start meditating, or get them some exposure to deep breathing exercises where they're doing that every day, right? Some sort of exercise regimen for older kids is like super helpful, whether they're running, walking, biking, going to the gym, right? I know that's like more popular now. And as we've all kind of returned to normal society, gyms are open, and there's probably really good deals at certain gyms because they are probably hankering for people. So yeah, like all those kinds of things can be really helpful for older teenagers. Journaling versus gratitude list. I would say both of those, Angie, have a lot of value. Journaling, it depends on the person. Some people really like journaling. I even say like you could do it in your phone, just kind of writing down some of your emotions or your thoughts, and kind of like that's super helpful. Gratitude journaling has actually, if you look up positive psychology, and gratitude journaling is actually shown to be really, really beneficial for all people. If we do like 5 minutes of gratitude journaling, it actually shows awesome results in terms of decreasing depression and anxiety and things like that. So simply going through and saying like, at the end of your day, these 3 things I'm grateful for, and they have to be different every day, right? That practice in and of itself is so incredibly healing and positive for us psychologically. So I would say neither one is better. It just determines like, it's determined by what you like better, or what your child likes better. If your kids, Cindy, if your kids don't talk about stressors to their parents, I would start with like, what's the relationship like? Not abnormal for kids to not want to talk to their parents. And yet I would say, do they have a mentor? Is there a family member that they might talk to? Is there a grandparent, an uncle, a coach, somebody at church, somebody where whatever setting? Is there someone else that they can talk to? Does your insurance, can you get them some help outside of the family? Because that might actually just be what they need, right? That like unbiased third party, that could be really helpful too. Yeah. Great questions, you guys.